You need to watch this video because last year alone, more than 500,000 women died of breast cancer. And this was so because they presented to the hospital very late, at a stage whereby we could do little or nothing to save their life. So if you're a lady or if you have a wife, a sibling or a girlfriend, then you need to watch this video because you might just be saving their life. So in this video, I'll show you 8 common breast signs that each time you see them, run to the hospital immediately. It could mean that you have breast cancer, and you can begin treatment as early as possible to save your life. I am Dr. Akoche, a licensed medical doctor. So let's dive right into the video. The first on our list here is the dimpling sign. The dimpling sign is also known as Peau the orange. It is called so because, it looks like the back of an orange. So now each time you look at your breast in front of the mirror and then you now see the changes that make it look as if it's the back of an orange with so many dimpling signs, then this is called the Peau the orange sign. It is a very common early symptom of breast cancer. So please, each time you look at your breast and then it looks like you have so many dimples on it, please run to the hospital and see a certified medical doctor. Do not treat anything at home. Do not rub any aboniki. Do not rub any herbal drugs. Don't take any drug. Don't prescribe any drug and take. Run to the hospital immediately. It could be an early sign of breast cancer. So this is so because there's a tumor in the breast that sends so many connective tissue to the skin and then they are pulling it. It's a very early sign of breast cancer. If you see this, run to the hospital. The second common signs that you see for breast cancer is called tethering. This is when the breast shows in a way that has, a depression. You might find 1 or 2 depressions somewhere, especially when the depression was not there before. So now each time you find any depression in your breast, this is called the tethering sign. And this happens whenever there is a tumor in your breast and then the tumor is now sending some connective tissues to your skin and then pulling your skin downward. So you find that depression in your breast. So if you find the tethering sign, please run to your hospital, run to the hospital, contact an oncologist immediately. You understand? Each time you see the tethering sign, it could be a sign for breast cancer. And most of the time, whenever you touch it, you might feel something, a lump, a cyst of different consistency. So do not forget to like and subscribe. The number 3 on our list here is called retracted nipple. This is when, the nipple is somehow pulled backward and inward. I know that everybody is born differently. Some persons might be born with, retracted nipple. Other women might be born with pointed nipple. But whichever case, if your nipple is somehow pointed before, and then over time you start seeing some retraction, then it could mean that, there's something going in there, like a breast tumor, a breast cancer that is somehow, pulling the nipple inwards. So please, if you notice this change, don't waste time, because anytime that you waste makes the condition to become more worse and with bad prognosis. So the moment you notice any retraction of the nipple, please go to the hospital immediately. Don't do any home remedy. Don't do any home treatment. Don't contact a friend. Run to the hospital immediately. The number 4 on our list here is called rash. Yes, breast rash. So if you notice any rash on your breast, especially flaky, crusted, or scaly rash, you understand, please report to the hospital immediately. It might not always indicate that it is breast cancer. It could be an eczema, it could be an allergic reaction to the bra that you are using, but you can never be too sure. So you need to rush the hospital for more clarification. And there are some a rare kind of breast cancer known as Paget disease that usually starts with, flaky rash or scaly rash or crusted rash. So you don't have to take it for granted. Report to the hospital immediately if you notice any rash on your breast. The number 5 on our list here is called redness or tenderness. As part of your breast examination, in front of the mirror, one of the things that you do is that, you touch the 2 breasts. This is called differential warmth. So you touch the 2 breasts. If you discover that one breast is hotter than the other, or if you discover that one breast is somehow swollen, or if you discover that, you are seeing some redness or changes on the breast, please run to the hospital. There's a rare form of breast cancer known as inflammatory breast cancer. And this is how it usually starts. So if you notice any redness, tenderness, difference in the breast size, please run to the hospital immediately. It could mean that there is something that is coming up, there's an underlying condition such as inflammatory breast cancer that needs an attention, and it is somehow very, very rapid. So please, if you notice this change, run to the hospital immediately. The number 6 on our list is nipple discharge. So if you are not pregnant or if you are not breastfeeding and you are seeing any nipple discharge, please run to the hospital and report it immediately. If you are seeing any form of discharge at all, either blood coming out, pus coming out, or milk coming out, please run to the hospital. So far as you are not breastfeeding or you are not pregnant, it could mean that there's an underlying pathology that needs an attention. The number 7 on our list is changes in breast size and shape. Everybody are born with different breast size and different breast shape, and one breast may be slightly larger or bigger than the other, you understand? But whenever you notice this abrupt change in the breast size and shape, it could mean that there's an underlying condition and that you need to report to the hospital as early as possible. I know that with menstrual cycle and pregnancy come with 1 or 2 changes in the breast size and shape, especially those that are breastfeeding. One of the breasts can be slightly bigger or even much more bigger than the other, and it could be normal. But if you're not breastfeeding and you notice that, okay, one breast has become somehow bigger than the other, even though you're not feeling any pain, please run to the hospital. It could be a sign of an underlying pathology, of an underlying disease, maybe a tumor that is growing that needs an attention. And the earlier you report to the hospital, the better the prognosis and the recovery. So please don't take it for granted. The number 8 on our list is called breast lump. So if you notice any breast lump at the course of your usual breast examination, your weekly breast examination, maybe standing before the mirror and then you touch one breast, then the other breast, or maybe if you are just taking your bath and then you notice any breast lump. Now, by saying breast lump does not just mean the breast here alone. You need to understand that the breast does not end on the chest here alone. It also extends down to your armpit, also known as the axilla. You understand? This fold of muscle here is also part of the breast. So if you notice any tumor there, you understand, maybe a cyst, maybe something that is growing there, please run to the hospital, report to the hospital as soon as possible. It could be a sign that there's a tumor growing, that there's a cancer growing. It could be a sign that there's a cyst there, you understand? So whichever way, try and run to the hospital for confirmation and also diagnosis. I want you to remember that, finding any of these 8 signs, it does not really mean that you have breast cancer, but it means that there is a need for medical confirmation and urgency, you understand, because it could be a breast cancer. So now I want you to send this video to somebody to save somebody's life today. I want you to share this video, on your page, share it to your WhatsApp status, to so many places, so that people can hear this information and get saved. And feel free to ask me any question in the comment section and I will be there to answer. So do not forget to like and subscribe. See you next time. Thank you for your time.